My name is Joe Ferrara with Boston Healthcare. And just a brief background on Boston Healthcare, we are a strategy consultancy focused on market assessment and access for technology innovators, including drugs, devices, diagnostics, and informatics. Today, we're going to speak to you and entertain questions on the role of informatics in precision medicine, focused on implications for technology innovators. We're going to cover quite a bit of ground today, but primarily focus on issues surrounding informatics as these technologies begin to move closer to clinical decision support and how informatics fits within the value-based healthcare context. We will focus on oncology. That will be a key clinical area lens that we will look at this issue through. And we'll also be focused primarily on the U.S. Today. And now I'd like to introduce my colleague, Mark Girardi, to take us through the first section.
Thank you, Joe. Once again, good morning and good afternoon, everyone. As Joe mentioned, what I'll do is cover the first section of this, which is to really look at oncology and precision medicine, and with particular focus on the U.S. value environment. So first, I'd like to take you through some of the market trends that are underscoring the need for informatics solutions within oncology. And the first of those is increasing prevalence. As we all know, the incidence of cancer is increasing and expected over the next several years to increase worldwide by over 40%. Additionally, there have been the introduction of many new but expensive oncology drugs, and many of these new targeted therapies actually have costs of over $10,000 per month. Another key factor from a clinician perspective is the need to reduce adverse events. And a significant number of cancer mortalities are really related to the side effects of treatment, especially chemotherapy. And so the hope is that personalized therapies and chemotherapies will help to minimize side effects and also reduce treatment-driven mortality. Another important consideration is the need for what's called participatory care. Increasingly, we're seeing the need for the patient to become involved in their decision-making. And as this decision-making is being shifted more and more to the patient, this will require that treatment options be presented to them in a way in which patients can make informed decisions. Another key element is around connected care, and obviously informatics can be a key driver and key supporter of connected care. And we're seeing that in order to manage costs in a growing volume of cancer, that hospitals are concentrating oncology care to ensure that they can provide cost-effective, high-quality care. And lastly, adopting a multidisciplinary approach, which is focused on improving processes and workflows that will be necessary to support the increasing demands of oncology care. So just to put into context, the total annual cost of cancer is approximately $216 billion in the United States. And pharmaceuticals represent the fastest growing component of oncology costs within the U.S. And this is really being driven by the expanded usage of biologics. In 11 of the 12 new drugs that were approved in 2012, had a cost of over $100,000 per year. So as these new and innovative treatments are coming to market, they're having an increasingly larger impact on the expenditures for oncology care. And if we look on the right-hand side and you look at the components of Medicare oncology spending, you can see that drugs represent approximately 18% of the total Medicare spend in oncology. And drawing your attention to the lower left charts, it's interesting to note that if we look at the cost associated with hematological malignancies, we can see that it represents a significant amount of spend relative to their prevalence.